Thank you and welcome to the show for today. The topic this morning is the pediatrics and childhood obesity, and we're fortunate to have with us to talk about pediatrics and childhood obesity the chairperson of the pediatrics department at Meharry Medical College, Dr. Bean. And of course, Dr. Bean will give us a lot of information in reference to her own background and other information relative to some of the things that eventually led her to the chairperson of the Department of Pediatrics at Meharry Medical College. And of course, Dr. Bean, let me welcome you to the show this morning, and to tell you, Dr. Bean, how delighted we are to have you here, and not to have you to respond to that.
Well, I want to thank you for inviting me to come and join you. I am chairperson of the Department of Pediatrics at Meharry Medical College. And actually, I'm originally from Tennessee. I was actually born and raised in Winchester, Tennessee, and then left there to go off to college in Massachusetts at Mount Holyoke, and subsequently to the University of Pennsylvania, where I got a medical degree, and then moved to California and did residency and fellowship training there in neonatology at Martin Luther King, Charles R. Drew University of Science and Health. And now I am back here in Nashville as the chairperson of the Department of Pediatrics. As a neonatologist, I actually take care of 6 babies, and I was division chief there for many years. But as in my position there, I also ran all of the programs for high-risk children that were we saw at King Drew Medical Center. And that meant that we were the medical home for children with all kinds of problems. So I had programs that took care of kids who were exposed to drugs, and we had a large population of drug-exposed children. I also had programs that covered HIV kids. We had asthmatics. We had graduates of NICU. So we had a whole variety. We were the medical home for children who had potentially serious medical problems in South Central Los Angeles. And so I was then asked to come as chair of the Department of Pediatrics at Meharry Medical College, which of course was a great honor because, of course, having been born and raised in Tennessee, I knew about Meharry Medical College and always assumed that at some point in my life I would be here. And so destiny has brought me here as this particular time.
Very good. And I'm encouraged by that because I think that so many of us see ourselves at an earlier age doing things like this, and certainly coming from Winchester, Tennessee. You know, I know that people in Winchester, Tennessee were very, very proud of you. Wherever you were, but especially now at Meharry Medical College. But what we'd like to do today, Dr. Bean, is to give our audience as much information as we possibly can dealing with some of the things that you do at Meharry Medical College, and within the context of childhood diseases. Now, certainly we'd like to talk about childhood obesity because I think that that is one of the major issues that children are confronting today, and you've got a lot of information in reference to that. But you also mentioned some of the other issues that I think are very, very important, and that is HIV and other kinds. Let's talk about it from your perspective. Anything that you'd like to say in reference to some of those diseases?
Well, Meharry Medical College Department of Pediatrics and our pediatric clinic is located at Nashville General Hospital. We also have one up at 1919 Charlotte as well. But we take care of children from birth all the way up to 21. And in fact, we actually see children who are even older than that. We have an adolescent program, and we will see children as old as 24. Now, I know a lot of people don't think of children, childhood as going that far, but adolescents are a particular group of children with their own, or young adults, I should say, with their own unique set of problems. So we represent a medical home for children all the way from birth through adolescence. And at our clinic, we are able to see all of those children, and we specifically focus upon health disparities. And so that means that we have as a particular charge at the medical school as well as the Department of Pediatrics addressing those issues which disproportionately address the health or minority and low income and health and children who are in environments in which they may not necessarily have the optimal health. So we have problems related to asthma, we have problems related to drugs, we have problems related, as we said, to HIV, and of course childhood obesity, which is a particular problem in that particular population.
Very good. And of course, we're getting ready, Dr. Bean, for our first commercial break, after which we'll come back and give you an opportunity to perhaps talk about some of the childhood diseases. I think it has been said that many of us often think of children as small adults, and we never think in terms of the kind of different medical treatments that are required. And so you might want to deal with that during this second segment. And of course, we'll, excuse me, we'll be back with our audience following this very, very short commercial break. We're talking to Dr.